Hello, Dr. Kevin Connors here again for your Members Minute. Trying to give minutes of information to our members so that the more informed patients that we have, better off you're going to do. So we've been talking about Lyme disease for the last several member minutes. Then we've been talking about that Lyme disease is a Th1 dominant disorder and that you can't take Th1 stimulants. So Th1 is the killer side of your immune system. So protocols that use things that are going to stimulate this side stimulate tissue destruction. They may help for a period of time, but the patient ends up crashing and it just doesn't work because you're destroying your own tissue. So how do you kill a biotoxin, a living organism, that is a pathogen, that is hurting you and is injuring you and is out of balance, like Lyme disease and all its co-infections? How do you kill it if you can't stimulate the immune response? Yeah, kind of tricky. So we can't stimulate a Th1 response to kill Lyme disease. That's where long-term antibiotics can work. So we're going to put you on antibiotics for the next 5 years. And as long as you got that antibiotic flowing through your veins, you know, every time it peeks its little ugly head outside the cell, we're going to be able to kill it. So there's some advantages to that. And you might have seen people that have been cured using long-term antibiotics. Well, you know, there's lots of side effects to that. So that's not our preferred method. There's other ways to kill it. You could use nutraceuticals that are not Th1 stimulants. So some of the examples of that would be MMS, lauricidin, hydrogen peroxide. Those are just some examples. There's several more. So those are the things that we test on a person on what is going to help kill that Lyme disease. Many times in our office, none of those work for the patient either. What always works to kill a Lyme disorder is using frequency medicine. So that's what we use in our office. So frequency medicine in the form of a Rife machine. Now a lot of people call our office or see my videos or read my book and say, we've used a Rife machine, it didn't work. We had somebody today call our office. It happens at least 3 times a week. Today call our office and they were livid because I was going to this doctor in California and he's been doing the Rife machine 3 times a week. I go in there for an hour a day and he's taking so much money, it's costing me a fortune and it's just not helped me. Well, I can tell you right now, 3 times a week for an hour a day doing the Rife machine ain't going to do nothing, even if you have the best Rife machine, which I like the best Rife machine, the True Rife. It's not going to work. It's just, you need a lot more Rife time than that. It just doesn't work. And I say that by experience because we used to do the Rife in our office 3 times a week, 1 hour a day. And we'd get a little bit of results and the person would crash again. So it just doesn't work. And then we'd up it. We're going to do 2 hours. We're going to do every day. Until we went to an at-home program, it didn't work. Since we went to an at-home program, it always works. We have not failed with a Lyme patient. And we're doing a lot of other things too. But that's, frequency medicine is the thing. And we'll talk about that on our next Members Minute. Thanks.